Welcome to Catalyst Med Up, where we ignite understanding and make learning easier. In our today's class, we'll be looking at the anatomy of the breast. The breast is a modified sweat gland that is situated at the pectoral region. In fact, it is one of the most important organs located at the pectoral region. It is present in both sexes, though it is rudimentary in male and well developed in female after puberty. Occasionally, a breast may be well developed in male as well, and the condition is called gynecomastia. The breast as well is situated at the superficial fascia of the pectoral region, and it serves as an accessory organ to the female reproductive system. It provides a nutrient in form of a milk to the newborn baby. So that is short introduction about the breast. Next is the location of the breast. The breast is located at the pectoral region, particularly in the superficial fascia of the pectoral region. And the breast is made up of 4 quadrants. There is upper 2 quadrants and the lower 2 quadrants. There is upper lateral quadrant, upper medial quadrant, lower lateral quadrant, and lower medial quadrant. There is an extension that is located on the upper lateral quadrant, which is called axillary tail or spines. And this axillary tail or spines pierces the pectoralis major, or it pierces the pectoral fascia and lies deep in the axilla. The foramen through which it passes to the axilla is called the foramen of Lange. This axillary tail or spines, it is a site of high percentage of breast tumor. The next one is the extent of the breast. When the breast has 2 extensions, it is extended vertically as well as horizontally. Vertically, the breast extended from the 2nd to the 6th rib, while horizontally, it extends from the lateral border of the sternum up to the mid-axillary line. Looking at this structure here, it shows us the location and extent of the breast. We said that the breast has 4 quadrants: the upper lateral, the upper medial, lower lateral, as well as the lower medial. There is an extension that is situated or that is present in the upper lateral, which we call axillary tail of spines. So from here, this is our axillary tail of spines. And we say this axillary tail of spines is site with high percentage of the breast tumor. That is, majority of the breast cancer or the breast tumor arises from this site. And it pierces the pectoral fascia by passing through foramen of the Lange, then lies in the axilla. Vertically, the breast extends from the 2nd rib. This is the 2nd rib. From the 2nd rib down to the 6th rib. Whereby horizontally, the breast extends from the lateral border of the sternum. From here, this is the lateral border of the sternum, up to the mid-axillary line. This line here is our mid-axillary line. So this is about the location and the extent of the breast. Structures of the breast. Structures. For the easier understanding, the structure of the breast are divided into 3: the skin, the stroma, and the parenchyma. On the structures, there is 1, the skin; 2, the parenchyma; and 3, the stroma. The skin. The skin is the one that covers the breast, and the skin provides 2 major structures. The structures are the nipple as well as the areola. So the skin as well provides 2 structures. The skin provides the nipple and the areola. To the nipple. The nipple is a conical projection that is situated just below the center of the breast at the level of the 4th intercostal space. The nipple have longitudinal and circular smooth muscles, which allow it to flatten or stiff. The nipple is also well supplied by a nerve ending. In fact, it's the most sensitive part of the breast due to the numerous nerve ending that is present in it. It is also pierced by 15 to 20 lactiferous ducts, through which the milk is ejected to the exterior. The areola. The areola is just a circular region that is situated at the base of the nipple. Though the color of the areola depends on the complexion of the woman, the areola contains many modified sebaceous glands. This modified sebaceous gland, they secrete a oily substances which prevent the breast from drying out. During pregnancy, this sebaceous gland of the areola, they become enlarged and form a tubercle, which is called the tubercle of Montgomery. Tubercle of Montgomery is an enlarged, modified sebaceous gland which is seen during the pregnancy. The next is the parenchyma. The parenchyma is also called the mammary gland proper. It is responsible for the milk production. The parenchyma is made up of 15 to 20 lobes, and each of these lobes are further made up of lobules. And each lobules, they are the cluster of a cells, that is acini cells. These 15 to 20 lobes present in the mammary gland, they are drained by the lactiferous duct, which conveys towards the nipple. Before their termination in the nipple, the lactiferous duct enlarged to form the lactiferous sinus. This lactiferous sinus, that is where the stored milk are found. In general, the parenchyma is the structure of the breast where the milk production takes place. Next is the stroma. The stroma just serves like a skeleton of the breast because it provides a framework support to the breast. And the stroma is made up of majorly two parts. It's made up of connective tissue and the fat. The connective tissue is modified to form fibrous stroma, which in turn form a structure which is called suspensory ligament of copper. Suspensory ligament of copper. This suspensory ligament of the copper is one that anchor the skin and the breast to the pectoral fascia. Fat. The fat is also called the stroma fat and is one that forms the bulk of the breast. It is present in all parts of the breast except beneath the nipple and the areola. So the entire part of the breast is formed of the fat except the nipple and the areola. That is about the stroma of the breast. Now this structure here will show us the various structures of the breast. From here, these are the lobes of the breast. We said each breast has about 15 to 20 lobes, and each of the lobes, they are made up of lobules, and each of the lobules, they are clusters of acini cells. So these are the lobes, and these lobes, they are being drained by lactiferous ducts which converge towards the nipple. So this open here, they are the lactiferous ducts. The lactiferous ducts. And before they are opening in the nipple, each lactiferous duct enlarge in size and become lactiferous sinus. This lactiferous sinus is a space where the stored milk are found. So this enlarged space here is our lactiferous sinus. And coming down here, all this line here, or all these structures here, they are what we call the suspensory ligament of copper. The suspensory ligament of copper. It is being formed from the fibrous stroma, and it anchors the skin and the breast to the pectoral fascia. This is our pectoral fascia. This pectoral fascia is the fascia that covers the pectoralis muscle. So behind here we are having pectoralis muscle. So this is about the structure of the breast. Now moving on to the next agenda, which is the relation of the breast. It has the relation with the following structure from the superficial to the deep. The breast has a relation with the pectoralis fascia or the pectoral fascia, which cover the pectoralis major. And deep down it has a relation with three muscles. The muscles are the pectoralis major, serratus anterior, and external oblique muscle of the abdomen. These are the three muscles in which the breast has a deep relation with the pectoralis major, the serratus anterior, and the external oblique muscle of the abdomen. Next is the arterial supply. Mammary gland or the breast, it is highly vascular, and the mammary gland is supplied by the following arteries. 1. It is supplied by the internal thoracic artery. The internal thoracic artery through its perforating branches. It is supplied by the internal thoracic artery through its perforating branches. It is also supplied by axillary artery through its superior, lateral, and thoracoacromial branch. And lastly, it is supplied by posterior intercostal artery. It is also supplied by the posterior intercostal artery through its lateral branches. So these are the arterial supply to the breast. It is supplied by the internal thoracic artery through the perforating branches, supplied by the axillary artery through the superior thoracic axillary artery, the lateral thoracic axillary artery, and the thoracoacromial branch of axillary artery. It is supplied also by the posterior intercostal artery through the lateral branches of the posterior intercostal artery. Coming to this structure here, this is about the arterial supply of the breast. Here is the axillary artery. And we said the branches of the axillary artery that supply the mammary gland are 1. The superior thoracic artery, 2. the thoracoacromial artery, and 3rd one is the lateral thoracic artery. Also, we said that the mammary gland is also supplied by the internal thoracic artery through its perforating branches. This group of artery here, they are the internal thoracic artery. And lastly, we said they are also supplied by the posterior intercostal artery through their lateral branches. The group of the artery here, they are the posterior intercostal arteries, which supplies the mammary gland through their lateral branches. So this is about the arterial supply to the breast. The next one is the venous drainage. The veins that drains the breast accompanies the artery. That is, there is internal thoracic vein, posterior intercostal vein, and the axillary veins. Now, the veins converge towards the base of the nipple, where they form an anastomotic venous cycle. From there, they now runs in 2 sets. They run as the superficial and as the deep veins. So the veins run as the superficial and the deep vein. The superficial vein drains into the internal thoracic vein, while by the deep veins drain into the internal thoracic vein, axillary vein, as well as the posterior intercostal vein. The venous drainage of the breast have a very important clinical correlation, because the tumor of the breast or the cancer of the breast can migrate to the brain through the venous drainage. The pattern through which the cancer cells from the breast migrate to the brain are as follows. The pathway is cancer cells of breast. The cancer cells of the breast, they are drained through the venous drainage into the posterior intercostal vein. Then from the posterior intercostal vein, they move into the vertebral venous plexus. From the vertebral venous plexus, they now move into the intracranial dura venous. Then from there, they move to the brain. So the cancer of the breast can migrate to the brain through the venous drainage of the breast. Next is the nerve supply. The breast is supplied by the anterior and lateral cutaneous branches of the second to the sixth intercostal nerves. The lateral and the anterior intercostal artery of the second to the sixth intercostal nerve supplies the breast. They provide cutaneous innervation to the skin of the breast and autonomic fiber to the blood vessels and the smooth muscles. I will also take note that the milk production of the breast or the production of the milk is not under neural control. It is majorly controlled by an hormone, prolactin, which is secreted by the pituitary gland. Next one is the lymphatic drainage. The lymphatic drainage of the breast is very important to take note of because the cancer of the breast migrates to other regions through the lymphatic vessels. So, for the better understanding of the lymphatic drainage of the breast can be discussed under two main things. First, we will look at them under the lymph node, and we will also discuss them under the lymphatic drainage vessels. The lymph nodes of the breast, or the lymph node that receives the lymph from the breast, are the axillary group of lymph node, 2, the posterior intercostal nodes, the deltopectoral node, that is also called the cephalic node. There is also internal mammary node. In addition to these ones, there are also subdiaphragmatic and subperitoneal nodes. These are the nodes that receive lymph from the breast. To the lymphatics of the breast, the lymphatic drainage of the breast occurs as follows. Both lateral quadrants of the breast, they are mostly drained into the axillary group of lymph nodes and mostly to the anterior axillary group of lymph nodes. Because axillary nodes, they are grouped into 4 or 5 groups. There is apical group, the anterior group, the posterior group, the lateral group, and the central group. So the lymph from the lateral parts of the breast, both the upper lateral and the lower lateral, they are mostly drained into the axillary lymph node. While the lymph from the medial quadrant, the upper media and the lower limb media, they are mostly drained into the internal mammary lymph node. Our subperitoneal node, and here is the internal mammary node. There is also supraclavicular node. There is apical group node as well as the deltopectoral nodes. These are the lymph nodes that receive the lymph from the breast. We said that the lateral quadrant, the upper and the lower lateral quadrant, they majorly drain to the anterior, they majorly drain to the axillary lymph node, but which part? They majorly drain to the anterior axillary lymph node or anterior axillary group of lymph node. So most of the lymphs from the lateral quadrant, these are our lateral quadrant, most of the lymphs from the lateral quadrant, they drain into the anterior group of axillary lymph nodes, whereby the lymphs from the medial quadrant, that is the upper media and the lower media, they mostly drains into the internal mammary lymph node. Some lymphs from the lower lateral, they drains into the posterior intercostal node, whereby some lymphs from the lower media communicate with the subperitoneal node by piercing the linea alba and the anterior abdominal wall. Deep to the areola, there is what they call subareolar lymph plexus of Sapi. This is what drains the lymph of the areola into the anterior axillary group of lymph nodes. Deep to the breast, the lymph pierces the pectoralis major and drains into the apical group of axillary lymph node. Next is the clinical correlation. One of the most important clinical correlation of the breast is the breast cancer. The breast cancer, it is formed or it arises from the epithelium of lactoferous ducts, and it majorly seen or majorly occur in postnatal woman due to the lack of an hormone estrogen. The clinical features of the breast cancer includes: 1, there will be presence of a hard and painless lump. 2, there will be a retraction of the nipple. The retraction of the nipple arises due to the infiltration of the lactiferous duct. There is also what they call pale the orange appearance of the breast. Pale the orange appearance. This is when the skin of the breast appear like the skin of the orange, and it occurs due to the obstruction of superficial lymphatics. Another clinical feature of the breast cancer is the retraction of the breast. That is due to the infiltration of the suspensory ligament of the copper. Also, the breast becomes solid and immobile as a result of the infiltration of the suspensory ligament of copper. So, the breast cancer is one of the most important clinical correlation of the breast. Another clinical correlation of the breast is what they call Crucumbel tumor. This crucumbel tumor is a secondary tumor that is present in the ovary, and it arises from the breast cancer. The cancer cells from the breast, they will move, or since we say that the lower medial quadrant of the breast communicates with the subperitoneal node, from there the cancer cells will move to the ovary where they develop a secondary tumor which is known as Crucumbel tumor. Another clinical correlation of the breast is mastectomy. That is the removal of the breast. It is what they call a radial mastectomy. That is the complete removal of the breast together with the surrounding structures such as the pectoralis major and axillary group of lymph nodes. Those are the major important clinical correlation of the breast. Next one is the development. The breast develops from an ectodermal thickening called the demic ridges or the line of Schwartz. So this is what gives rise to the breast. This make line present or is located from the axilla down to the groin. And human, it only persists at the pectoral region. Here, it undergoes development and becomes 15 to 16 lobules. And we should know that the stroma arises from the surrounding mesoderm. Next is the developmental anomalies. The developmental anomaly of the breast. There is what we call 1, polytalia. 2, polymartia, and 3, there is gynecomastia, so these are the common anomalies that arise during the development of the breast. The polytalia is an increase in the number of the nipple, whereby the polymartia is an increase in the number of the breast along the milk line, The gynecomastia is a condition in which a breast is well developed in a man, which usually arises as a result of hormonal imbalance. So we have come to the end of our class under the anatomy of the breast. Kindly subscribe, like, comment and share. Don't forget to turn on your notification bell so that you don't miss new video.